Welcome to Bridging the Gap. We're here to tell you about our study on the experiences of decision makers and scientists in getting psychosocial interventions from research to practice. Our findings are presented as a conversation between a scientist and a decision maker, both working to get psychosocial interventions to the families who need them. This story reflects data from 83 surveys and 37 interviews. Participants were decision makers and scientists. Each was responsible for developing or choosing psychosocial interventions for children with neurodevelopmental disabilities. Decision makers worked in health, education, or social services. Quotes from the interviews are presented in text throughout the video. Our decision maker and scientists have run into each other at a conference. Let's hear what they have to say.
Hi, Alex. It's been a while. How are you?
Hi, Sasha. Nice to see you. Things are busy as always. You know how it is.
Sounds familiar. I've got 3 studies on the go right now, plus teaching and supervising students. I'm trying to connect with organizations interested in adopting our interventions when the research phase ends, but it's hard to find time. It's almost another full-time job.
Yeah, same here. In my world, it's a juggling act to find programs and then get them up and running. A lot of that work happens off the side of my desk. I barely have time to see what's out there or to figure out whether an intervention would be a good fit for our team.
That's the tricky part, getting interventions that work in research settings successfully adopted into the real world. When studies show our interventions can improve outcomes, researchers still need to figure out how to get them taken up into practice. Where do we go? Who do we talk to? As a scientist, I expect that strong evidence for an intervention will make organizations eager to adopt it. But I know that's just the beginning. And unfortunately, there is no roadmap. Scientific training doesn't teach us how to scale an intervention much beyond publishing results.
Decision-making in our organization is influenced by many factors beyond evidence. Staffing constraints, funding cycles, leadership priorities, external policies, and political will. Even great interventions can fail to be adopted if timing or fit isn't right. We also need access to enough practical information to help us decide if something is feasible, like cost comparisons, training, staff requirements, impact on workflow, and whether we'll have ongoing support. And there's more. We need programs that fit to our context, the needs of our staff, and of our client families. Getting the chance to speak with scientists helps us see eye to eye to evaluate fit, anticipate extra work, and see what support might be needed for implementation from the very start.
So I'm hearing that evidence is important, but fit and feasibility also matter. You're saying that interventions that are too rigid or aren't a good fit can get rejected, even if the evidence is strong.
Exactly. Our families get supported across health, education, and social services, all with different mandates and funding rules. Those silos make adoption harder. If an intervention doesn't align with mandates, policies, or values, we can't move forward, even if the outcomes look strong.
It really highlights how complex our worlds are. We really need to understand the realities of each other's systems to make things work. That's something our team really focuses on.
Yes, sometimes policies and administrative constraints override everything, like who can deliver a program, who it can serve, and how funds can be used. They can be quite limiting.
Which I guess means if those constraints aren't considered early, the chances of scaling are pretty slim. Engagement is important to us. We often work with families and decision makers in designing interventions, not as much with the frontline workers, those who actually deliver the programs. Even with engagement, it's still challenging to get interventions adopted. Funding is one of our biggest challenges. Who is going to pay after the research is done?
Exactly. And short funding cycles make it worse. They don't always promote long-term sustainability of the programs we adopt.
We have the same problem. Getting research grants is super competitive. I feel like what gets funded always needs to be new and innovative, and there's not as much support for sustaining existing programs. As researchers, we always need to be moving on to the next thing.
Yes, we sometimes suffer from pilotitis. Interventions get piloted for a year or two and then disappear because the funding dries up. Staff, leadership, or government turnover can also be an issue for sustaining programs over time. We need to build sustainable systems from the start, not just introduce pilot after pilot.
Same thing can happen with our connections. Partnerships and connections are really important to us. We can spend years building relationships with organizations or government contacts. Then there's an election, or priorities change, or your contact leaves. Our hard work disappears and we need to start again. It's a real problem for us.
It's not all bad news. Partnerships with other organizations has been really helpful in getting programs off the ground. And having some support embedded in the organization, someone who can guide adoption and help staff integrate the new intervention, is a game changer. We have a ton of outcome data from our programs. We do a lot of evaluation on outcomes for quality improvement. It would be fantastic to have a researcher help us to further analyze that data. Could be a research opportunity.
We collect information on outcomes for the intervention. That's our specialty. We also try to build in economic analyses into our studies now. That's really important for funders. Training and resource development are also a part of what we do. It all helps to bridge the gap between science and practice. It's been great chatting with you. Seeing things from your perspective helps me think about how I can better design interventions that suit your needs.
At the end of the day, we both want the same thing: interventions that improve well-being, social, emotional, and behavioral functioning for children with neurodevelopmental disabilities and their families.
Looks like the act of bridging our worlds is the actual intervention we need.
Exactly. Collaboration is where the magic happens. We just need a way to make that feasible and sustainable. Let's keep the conversation going.
Thank you to all study participants, our advisory committee, and for generous support from the Child Bright Network and the IWK Foundation. Please visit our website for more information about the study and for contact information.